I'm Katie Flanagan, and I am Chloe Flanagan's mother. After having twin boys, I was very excited to find out I was having a girl. At 17 months, Chloe was diagnosed with ALL leukemia. It was shocking. It was overwhelming, of course, very emotional. You just never expect that you're going to be in those shoes.
All I could think about was, what would our lives be like if we were to lose Chloe? And honestly, I thought for the worst.
I met Chloe when she was asleep. I did her first procedures. And then I met the family shortly afterwards to start quickly to go over what the treatment plan was going to be. I think that people do well even with bad news if you can give them as many facts as you can to try and give them the power of knowledge.
When she was walking through the treatment protocols, the research studies, the history, it was an immediate epiphany that, my God, we have a plan. We have something we can do to help our daughter.
Maureen informed us that Chloe's treatment would be about a 2.5-year treatment. And of course, when you're at the very beginning of that, that seems like a long time.
I think in some cases, when you think about going into a hospital on a recurring basis, maybe it's a sterile environment or it's just cold or you don't feel comfortable. That is not the experience for the patients and for the families at Lurie Children's.
When I tell Chloe that it's the day that we have to go down to Lurie Children's, she's very accepting of that, and I think it's an adventure for her to come down. The hospital has done a really good job with all the details and thinking of the ways to make the children comfortable when they come in and make it a happy place.
Everybody gets to know the families. You understand who they are, what makes them tick, what things help them get through this.
It's a team, and each piece of the team does such a great job.
There's a lot of low points. There's a lot of low points. It's at those moments where you see your child who can't walk or talk or eat or move because of the drugs. You ask yourself, is this the right thing? It's in those moments that you thank God that you have the treatment, you have the experts, you have the heroes who know what to do with these children when they're in these helpless situations.
Hello. Hi. How are you?
Good. Chloe finally reached the end of her treatment in March, and she's really doing well.
That sounds perfect, right?
When I see her being a normal child and a healthy child and a happy child, I just feel so relieved and so happy and so blessed.
Lurie Children's has been absolutely extraordinary through this entire journey. From start to finish, the capabilities, the expertise, the kindness, the communication has been absolutely exceptional. And of course, Maureen is a part of our family now.
For any patient that you take care of for this long, you get close to them. We're not saying goodbye, of course. We're going to be watching her closely off treatment, and it's going to be an absolute joy to watch her grow up. That's the whole purpose of this, is that we want her to grow up, we want her to succeed, we want her to do well in school, go to college, get married, have children if she wants. That'll be the joy of all of this.